should be based in Europe, and should have an interesting and innovative business model. We found 15 finalists. It was very hard to narrow them down, and I'm sure we also missed out on many cool startups. But the qualities of the entrepreneurs and their ideas that you're going to see today should be quite high. The winner of this year's pitch competition will receive a prize package worth 125,000 euros. This includes, for example, an investment proposal by APX. APX is Europe's leading early stage VC, backed by Axel Springer and Porsche. And they will provide a 50k investment proposal after a quick due diligence process. Then the winning startup also receives 36,000 euros in cloud credits of the cloud provider Scaleway. Always important for a company that wants to scale fast internationally. Then $10,000 in credits for Freshworks. By the way, for some of you, this deal might also be available if you talk to the Freshworks people downstairs at their exhibition booth. And yeah, we will be joined by a jury of well-known VCs from across Europe. So I would like to welcome on stage the jury now, and then they will introduce themselves quickly, and then we'll jump right into the pitch competition. So please welcome to the stage Lina Chong from Target Global, Volker Hirsch from Amadeus Capital Partners, Dr. Aline Fedder from Lakestar, and Henrik Bungerhoff from APX. Okay, do we have mics? Don't be shy, just come on stage. Okay, they're getting ready. And so the idea is that, yeah, just take a seat, perfect. The idea will be that we have 3-minute pitches, and after each pitch, we will have a 2-minute Q&A session, where the jury can ask some questions for the startups. And then we will move forward. I have some evaluation sheets for you guys here. Maybe pass it around, and some pens. All right. And then I would say maybe we start off with a short introduction. So maybe each one of you gives like a 1-minute pitch of who you are, what kind of investment firm you represent, and what kind of startups you're mainly interested in. You want to start, Aline?
Sure. Hi everyone. My name is Aline. I'm an investor at Lakestar. And Lakestar is a pan-European VC firm, investing stage agnostic, covering anything from seed up to Series D stage. So for us that means tickets between 1 up to 60 million euros. And I myself have a focus on anything health and climate tech. So those are the areas I get particularly excited about.
Thanks, yeah, my name is Henrik. I work for APX in Berlin, but we're investing in companies from all over Europe. Usually as the first investor. So this is our shtick. We do up to 500k in the first few rounds. And I'm super happy to be here. Thanks so much for putting together the event. It's super great to be among founders again in person. So we just had a portfolio day in London, and it was so nice after the long time of just video calls to catch up in person. I'm super looking forward to also talking to you guys individually during the day and tonight. Thanks.
Hi, I'm Lina. I'm an investment director at Target Global. We're a pan-European investment firm investing cross-stage, cross-sector. We're today about 3 billion in assets under management and cover pretty much everything from SaaS, consumer, fintech, etc. And I look forward to talking to some of you after this pitch competition. Thanks.
Hi, I'm Volker. I'm a partner at Amadeus Capital. I'm investing from early stage funds. Our current funds are 5th dedicated to research funds, 110 million pounds. We invested seed and A, first ticket between 1 and 4 million pounds. Other currencies are big. We're best known as a deep tech investor, according to PitchBook, which was said yesterday. According to PitchBook a few years back, we were apparently Europe's most active AI investor. Who knew? But we also do quantum and novel materials and stuff. I think we could also do.
All right, thank you so much for being with us. So I would say we just kick it off, the pitch competition, with the very first pitch. So joining us on stage now will be Jacqueline from Autoscriber. Please come on stage.
My name is Jacqueline Kazmaier and I'm one of the co-founders of Autoscriber. Now if you think back to your last visit at the doctor, how much time did you spend describing and discussing your current problem, your medical history and your social history? Maybe 10, 15, even 20 minutes? And of all of that information that was discussed, how much do you think actually ends up being used in your patient file downstream? Well, the answer is that 85% of valuable information discovered during doctor-patient consultations is lost. And that's in spite of the fact that doctors spend almost half of their time trying to capture this information. 85% is lost. Just imagine the effect that that has on accurate diagnosis. At Autoscriber, we aim to fix this by capturing the entire conversation between the doctor and the patient. We transcribe this in real time, and we automatically extract relevant clinical information from that conversation. This information is then structured and put directly back into the electronic health record, so that the doctor only has to approve what's already there rather than having to type out everything manually. So effectively, we're reducing the administrative load on the doctor whilst improving the quality of data in the electronic health record. And this data has the power to revolutionize healthcare. Our software is currently being used in clinical practice, and we're actively working with 8 hospitals across the Netherlands and Belgium to implement our solution. We're now at the stage where we're looking to expand to the Greater Europe area, and our biggest target markets here are Spain and Germany, so if you know anyone in the healthcare industry that might be interested, please hit me up. We have a validated business model that relies on a monthly subscription paid per doctor, with fees varying according to the number of features that they select. And based on this, we conservatively estimate that we can attain a market share of 4 billion euros per annum. There are other solutions in medical dictation and healthcare natural language processing out there, but in terms of real-time understanding of medical conversations, we're currently leading the market. This is a snapshot of our current team, and my co-founder Koen actually is sitting over there, so we're both here today if you want to reach out to us. Amongst us, we've already launched 5 successful startups, we've won 3 awards for NLP research, and collectively we have over 20 years of experience in AI. We have a strong partnership network, and we work very closely together with our early adopting hospitals. And together we're working towards a vision of 0 misdiagnoses in the world. If this vision resonates with you, or if you're an investor looking to participate in our upcoming seed round, please reach out to us, we'll be available all day. Or you can contact us on hello@autoscriber.com. Thank you very much.
Thank you very much, Jacqueline. Now we have time for some questions from the jury.
Great pitch, thank you so much from my side as well. I'd be curious, how do you measure the success of your product? Is it the time saved for the doctors, or is it the increased accuracy? And what kind of KPIs do you have for that?
So one of the things that we measure is the amount of structured information that's captured in the electronic health record. So there are structured fields that are currently used most often by doctors, but there are also unstructured fields. And we aim to fill the structured fields as much as possible, so the percentage of fields that we can actually capture with our software and the number of accepted suggestions that we make is something that we aim to measure. And currently our baseline studies that we've conducted have shown in one of our hospitals that these structured fields are to 99.98% never used.
Thank you.
Maybe just a quick one, thanks so much for the pitch. Regarding your customers, what is your experience so far in terms of talking to them? Who's making the decisions to work with you, and what are their main concerns?
So currently we're working on the department level. So the department heads are typically the ones that are making the decision. And a lot of the decision is still at that level backed by the doctors that are actually using the solution. So it's a lot about making their lives easier and actually reducing the time that they have to spend on admin. But involved in the decision are also more strategic level members of the hospital and they actually have the aim of achieving the quadruple aim of healthcare. That's a permanent mission overall, and capturing more high-quality data is a really important mission of theirs. So we're in a unique position where we can actually, on a practical level, address the needs of the doctor, and also on a strategic level, address the needs of the hospital.
Thanks. Yeah. Look, it's a pitch competition, so it makes sense that you only show kind of the value there. But is there any kind of difficulty sometimes in the sales process? What is it? What is it? The concerns that maybe doctors have, or these department heads? Is there anything you can share? I don't want to go too deep, but just to understand a bit where the struggles are currently.
Yeah, I think, as you can imagine, we spend a lot of our time on security and on making sure that everything is privacy compliant and that we have all of the right regulatory things in place. So that's, I think, something that's been slowing us down the most, and I think compared to other companies that can just very quickly scale up and sell to consumers straight away. So we've spent a lot of time perfecting that, and that I think is quite a large concern of everyone involved, rightly so. And the second thing is actually just that the doctors wanted to work and to be easy, and there I think the fact that we're small and agile helps us a lot, so we can make changes very quickly working together with the doctors.
Okay, thank you so much for your pitch, Jacqueline. Thank you much. Thank you. All right.